having a women's healthcare clinic in Center County, Pennsylvania. And of course, the purpose of this assessment is to address that there are no confidential, low-cost women's healthcare clinics in the area. All three of those criteria need to be met for this assessment to be fulfilled. Things to understand is that all healthcare providers in the area also see men, so there's no specific women's healthcare provider. And there's only one Planned Parenthood within a 50-mile radius, which Planned Parenthood is the notorious known women's healthcare clinic. State College, which is the big city in Center County, used to have one, but it closed in 2007. There is a pregnancy resource clinic, and it provides low-cost healthcare, but it's faith-based, which means you might be hard-pressed to find things like birth control and even abortions, anything that doesn't align with the Christian faith. And it will call your parents if a client is underage to tell them about what is going on. What does a low-cost healthcare clinic do? Of course, it does things like contraceptives and gynecological visits and pap smears, but what people don't know is it also does things like glaucoma testing and diabetes information, and of course STDs and STIs, because we know that women are more prone to STDs and STIs after they have unprotected sex, and also women or teens carrying or teen moms also have a high risk of having STDs and STIs. The sample is about 77,502 women. That's about 48% of the county, and that comes from the Census Bureau, so about half of the county is women. The information we're getting is coming from the U.S. Census Bureau, the Mount Nittany Hospital CHNA, or the Community Health Needs Assessment. Every hospital does one. They do it every 3 years. Ours just happens to be from 2016. Various peer-reviewed journals, and of course 3 interviews from Kendra Getting, Mary, whose last name wants to be withheld, and Ginny Poorman, all respective directors of their own foundations, which we'll talk about. Let's talk about Kendra, who's the director of Out of the Cold Center County. It's a night shelter, a warm place to sleep at night for the county's abused and homeless. Sees about 15 to 30 a night, and half of them are women. They cannot put women and men in different rooms. That's the problem. They don't have enough space. So that leads for inappropriate touching. And of course, the perpetrators are punished accordingly, but that leads for women to come out with some kind of sexually transmitted disease, maybe, and they get that from the sexual abuse both in and out of the shelter. And because of that, all women are taken to the hospital, not to a clinic. And there's no employed social worker, so they have to use the social worker at the hospital. Over at Ginny Poorman, over at Hearts for Homeless Shelter, which is the day shelter for the homeless, lunch is served there, as well as various snacks and toiletries. But because 31.5% of the county is made up of poor women, Poorman also often runs out of women's sanitary napkins and tampons and all the other things that women need to survive. And because she only has a 500 square foot shelter, there's only one bathroom, and that doesn't leave much privacy for women to take care of themselves and do things in private that they need to do when it comes to their health. And a women's healthcare clinic would alleviate that. Also, by Poorman's account, most of the women sit in the same clothes all day, which means they're bound to catch some sort of disease like a UTI or an STD just from being dirty. Again, if a woman gets sick at Hearts for Homeless, they sit and they go to the hospital, and then there is no employed social worker there either. Last is the Center County Women's Resource Center, directed by Mary, whose last name is withheld. It provides a 24-hour helpline and asylum for domestic abuse victims, and it finds them safe homes, so they're not homeless. And over 95% of their clients are women. And they do not provide any medical counseling despite their name. Again, does not employ a social worker. There's no employed doctor or nurses. And again, they send sick women to the hospital, and they usually come back to the safe home only hours after seeing a doctor. So the key findings and common themes are that all women are sent to the hospital if they have a medical need, and none of the foundations have social workers. The women are quickly discharged out of the hospital without adequate care. You know, hospitals have a lot going on. They don't really have time for poor women coming in with STDs. None of the resources are equipped to handle any sort of emergency or STD, STI testing for a woman who's been sexually abused by rape or other sexually abused traumas. What are we doing? What is the solution? One of those suggestions was to start a women's coalition because there are no active women's rights groups right now working on this. Women's healthcare has been put on the back burner since 2007 when Planned Parenthood closed, and there's no town halls dedicated to this issue whatsoever. Then, of course, the other option is to open a Planned Parenthood. Planned Parenthood has been doing this for 100 years. They know what they're doing, and there's a law that's Southeastern Pennsylvania versus Casey, which basically gives a little more confidentiality to women when it comes to contraception and birth control. Sharing these findings with my interviewees. I love meetings, and my interviewees love meetings. The only thing is that Mary does not like public meetings, so I'm hoping I could build some sort of trust with her, so one day we could have a meeting with the boards of trustees of all these foundations to talk a little bit about why we should be fighting for women's health and women's healthcare needs. And then we're going to talk a little bit about assessment and key factors. Hindrances for me during this assessment was that this was a cause near and dear to my heart. So I stood on my soapbox a little bit and I let subjectivity get in the way. But that was kind of a lesson, and it taught me how to take criticism on how to reframe my macro social work. And it also taught me how to find the right people to interview. You know, a lot of people don't want to talk about this touchy subject despite me wanting to. And it helped me learn to make some decision on how to formulate questions. Again, people don't want to talk about this kind of stuff, so you've got to be really, really careful. I also learned that in a macro social sense, it's sometimes in a small community and not a huge group. So instead of looking at all women in the country, we just looked at Center County. And on the other side, it's hard to find people in a conservative town to talk about contraceptives. So one of the hindrances is that the town is very faith-based, and I couldn't find anyone to talk. And that is one of the big things that helped me become a better social worker. This was a high difficulty level because people are a little weary to talk about women's health care and contraceptives. It makes them uncomfortable. So for me to be able to get those people to talk a little about it helped me become a better social worker. Again, macro social workers wear many hats, and I learned that. I analyzed information from the CHNA and the Census Bureau. I did a lot of interviewing, and I had compassion for all the players in this project. All the women in this project needed that compassion, and I showed it to them. I also learned to be a researcher and an organizational leader and an advocate, and those are all really big things on becoming a macro social worker. And lastly, my references. And I believe that's it. I cannot wait to see your discussions, everyone. Thanks so much.